Okay, so today my presentation topic is the effects of 6 weeks resistance exercise delivered via the telerehabilitation in patients with chronic obstructive pulmonary disease. And I'm Po Ching Huang, I'm from Taiwan. Okay. So the chronic obstructive pulmonary disease is an obstructive lung disease that is not fully reversible, and its symptoms of coughing, sputum production, and dyspnea, along with the extent of the comorbidity disease and acute exacerbation, has caused the COPD, a chronic disease with the heavily medical burdens and financial burden. And the clinical guideline from the major organization, that is GOLD, suggested that the pulmonary rehabilitation as an effective approach for COPD. And it contained, but not limited to, the medication, psychological support, or the health education, and the exercise intervention. And among all these PRs, suggested PR program, the exercise intervention has gained the most attention for its benefit on improving the general physical status and the quality of life of COPD. However, different exercise may result in a different treatment effect. For example, in aerobic exercise, a significantly improvement was found in the exercise capacity and health-related quality of life. However, except these two improvement, an additional enhancement of muscle strength and muscle mass was observed from the PR program with the combined aerobic exercise and the resistance exercise. As for the resistance exercise only, the treatment effect was found in enhancing the muscle strength, the respiratory muscle force, and because that the resisted exercise could contribute to the ventilation response and also improve their muscle strength. It could also improve their task performances and also their pulmonary function. However, the practice of pulmonary rehabilitation among the COPD still remains low, and the relatively low motivation in the COPD may derive from the no supporting system, or the transportation difficulties, or lack of interest, and problem-related issues, such as the insufficient treatment effect, and will cause the unsatisfactory toward the treatment. And accordingly, the telerehabilitation is a rehabilitation derived via a variety of technological support. And it was proposed as a potential solution with the reported effect of the higher satisfactory and also the better compliances. Therefore, the purpose of the present study was to investigate the potential effect of the 6 weeks resisted exercise derived via the telerehabilitation in patients with COPD. So we recruit a patient with COPD from the National Cheng Kung University Hospital in Taiwan, and after the participant agreed to join the study, they were allocated to the control or the telerehabilitation group, the TR group, according to their own witness. And then they will receive a 6 weeks intervention, and assessment will be conducted at baseline and post-test. So the first one is the inclusion and exclusion criteria will show on the screen. So inclusion criteria including the age over the 40 years old with the control comorbidity disease, and also the participant will be capable to use the social medias of YouTube and communication apps names Line via the smartphone. And they also need to live with at least one relative who has a smartphone with the access to the internet. And the visual or audio assisted device will be acceptable if necessary. And the exclusion criteria, including the first one, is present with any other respiratory disease such as OSA, the obstructive sleep apnea, or the lung cancer will be excluded. And the second one, if they have any acute episode in the past 4 weeks, will also be an inclusion criteria. And the third one, if they participated in any other pulmonary rehabilitation program in the past 6 months will also be excluded. Okay, so the participants were allocated to the control or the TR group according to their willingness. In the control group, the participant will receive the conventional treatment, and the health education of home program will be delivered in the pictures. And additionally, the concept of the rate of perceived exertion and the principle of the intensity adjustment will taught to the participants to help them to adjust their exercise intensity. As for the TR group, the participant will receive the health education instructed in the video form. Moreover, they were required to report their RPE weekly, and the therapist will provide the selected exercise prescription along with the intensity adjustment according to the participants' reported efforts. And the assessment, for the assessment, the respiratory muscle strength was measured by the pressure gauge, and the spirometry was used to assess the pulmonary function. And the handheld dynamometer will be used to assess their muscle strength. And the 6-minute walking test was used for assessing the functional performances. Lastly, the Euro QOL 5-dimension and MMRC, CAT, CCQ will be used to measure in their quality of life improvement. Okay, so here's the result. The table 1 demonstrates the baseline characteristics of the participants, and no significant differences was found at the baseline. And the table 2 demonstrates the results of the outcome measurement. In this, the MIP and MEP and hand grip strength and the 6-minute walking distance has shown a significantly within group improvement in the TR group, while the bicep strength show a significantly within group reduction in the control group. Okay, so I would like to give the book, sorry. So the present study, we have investigated the effect of a 6-week resisted exercise delivered via telerehabilitation in patients with COPD. And our results demonstrate the significantly improved MIP, MEP, hand grip strength, and the functional performance in the within group comparisons of the TR group. In addition, the muscle strength show a statistical reduction in the within group comparisons of control group. The improvement of the respiratory muscle strength, the limb muscle strength, and the functional performances has suggested that the 6 weeks resisted exercise conducted by the telerehabilitation could significantly generate the beneficial effect in patients with COPD. So the first one, the muscle weakness, we'd like to discuss. Okay. The first one we'd like to discuss is that muscle weakness is a common problem we observed in a patient with COPD. And the study has shown that resisted exercise could significantly improve their muscle strength. In addition, the ventilatory effort and the respiratory load generated during performing the resisted exercise could significantly improve their respiratory function and the functional performances. Therefore, in the present study, we can found a significant improvement of muscle strength, respiratory muscle strength, and their functional performances, which is concurred with the previous studies. And the second thing is that telerehabilitation has demonstrated a sufficiently treatment effect. A study has reported that the sessional educational component and the emotional encouragement, along with the social support, were the part of the reported element that could facilitate the individual's engagement in the telerehabilitation. So in the present study, we use the video form of educational material, which might be sufficiently for the participants. And also we need them to, we require the participant a weekly feedback of their RPE. This may prompt, these factors may prompt their self-determination of the participant, encourage them to engage more in the programs. This results in this sufficiently treatment effect. And the third, the improvement of MMRC in the TR group and the reduction of CCQ in the control group has shown a marginal significance. So the study reported the minimal clinical importance differences of MMRC and CCQ were approximately 1 and 0.4 respectively. And in the present study, the improved MMRC in the TR group was 0.46 with a p-value of 0.053. And the reduction of CCQ in the control group was 0.51 with a p-value of 0.054, which could be considered as the closest to the reported MCID. So, speculatively speaking, the results regarding the quality of life suggested the alleviation of symptoms in the TR group and the health status deterioration in the control group. Okay, so conclusion here, we'd like to address that the present study has investigated the effect of the 6 weeks resisted exercise delivered by the telerehabilitation in the patient with COPD. And the result has showed a significantly improvement on the respiratory muscle strength, the hand grip strength, and the functional performances in the telerehabilitation group. And in addition, a significant reduction of the bicep muscle strength was observed in the control group. So accordingly, we could conclude that the resisted exercise delivered by the telerehabilitation could be implemented into the routine pulmonary rehabilitation for COPD, especially during the COVID-19 pandemic. And future studies could focus on the treatment effect of the supervision or the group participation to provided more practical results on conducting the telerehabilitation in the COPD. So this is the end of my presentation. I'd like to take some questions. Thank you.